Good afternoon, everyone. Thank you so much for tuning in to the Facebook Live this Friday afternoon. My name is Valerie Lane. I'm a proud MILLSUMMIT Planning Committee member, and I am here today with Molly from the state to talk about the latest development in the COVID Alert Delaware app. Molly, why don't you introduce yourself to the MILLSUMMIT community here on Facebook?
Thanks, Valerie. Thank you so much for having me. I'm so honored to join this group today to talk about a very important development in our efforts against COVID-19. So my name is Molly Magarik. I am the Cabinet Secretary for the Delaware Department of Health and Social Services, which is the lead agency in response to the COVID-19 pandemic. We have a number of divisions, but the key division in the response effort is our Division of Public Health.
Amazing. Thank you so much for taking the time to be with us. The MILLSUMMIT community is definitely a strong one. We like to stay connected on Facebook. Obviously, we get to be together during the conference every August, although this year was virtually due to the pandemic. And so what the community is really interested in learning about is, how does this app work? I've seen a couple of news alerts about it. I know the University of Delaware has made a big effort to have students download the app, but why don't you just start off, Molly, by telling us, how does COVID Alert Delaware, how does it work?
Sure. So again, thank you so much for this opportunity. So COVID Alert DE is, again, an app that's available on both Android and iPhones. And we really wanted to embark on this, the path to get an exposure notification alert, because how our traditional system works is people test positive for COVID-19, unfortunately, and then they will get called by a contact tracer who attempts to find out who else they may have exposed to COVID-19, and then they will reach out to those people, and that system's anonymous. We never reveal who is the person that tested positive when we call their close contacts. But the challenge with that is that you have to know who people are. So if you were at a gathering, perhaps a backyard party, or something where you were with a group of people where you don't always know the person, or if you know them, you don't necessarily know their contact information, then we don't really have any way to reach out to that person and let them know about their exposure to COVID-19. So again, an exposure notification app we thought was going to be a really valuable supplement to our efforts. And so I want to reassure people that we've heard had a lot of conversations around privacy. And, I know people hear app and they're like, oh no, does this use GPS or any sort of location tracking? And it does not. So what the app does is it uses Bluetooth low energy technology to alert users if they have been in close contact, which is defined as less than 6 feet for 15 minutes or more. And so if the people in question, the person who's positive and the person or persons who they were in that close contact with, if both of them have the app downloaded, then COVID Alert DE, the app on both phones, will exchange Bluetooth keys. And so those are random numbers that change every 10 to 20 minutes, and it happens in the background of the user's phone. And so the keys are exchanged anonymously. Again, it has nothing to do with tracking you or using your location, but the keys are exchanged. So again, if one of those individuals tests positive, the person is once the test result comes into the Division of Public Health, the person is contacted and they're asked by the contact tracer if they have the app on their phone. And if they say, yes, I do, they are offered a 6-digit code. And it's completely up to the person whether they enter that code. We obviously hope that they do. But once they enter the code into their phone basically uploads the keys, and the anonymous keys are checked against keys from other phones that have been in close proximity to the person over the period of a few days. And so it's looking, again, based on the date of the person's test, the duration of the exposure, but all of that is done anonymously in the background. And then again, if somebody puts it in, they put their code in, anybody who has been in contact, they get an anonymous alert via the app that, again, doesn't tell them who it was. It just says that they have likely been exposed to COVID-19, and it gives them a number of steps that are recommended by public health for people who, again, have been in close contact with somebody who's tested positive.
That's incredible. And such a great usage of this low data in the background, because I know that, long road trips and using maps for a long period of time could really just sort of like suck the life out of your phone. So a really low energy way to be able to go about doing this. So thank you so much for explaining us all through that. I feel like a situational example might be helpful for especially the MILLSUMMIT community. So I'm just thinking to myself, what have I done in the past 24 hours, that may have exposed me to coronavirus? Obviously, I wear my mask, but you never know, right? So I went and got coffee at Little Goat Coffee Roasting in Newark today. And there was a couple of people in line ahead of us, and we maintained 6 feet of social distance. But say the app is on my phone, and other people in line have the app on their phone too. So just to make sure I'm understanding it correctly, they're exchanging data, sort of in the background when we're standing in line together. Yes, even if we're, a little bit farther than 6 feet.
So it needs to be, and again, this is technology that is still being refined. So it's it may be slightly off, but we expect that the technology will continue to get refined. But if you're within 6 feet for 15 minutes or more. So chances are, depending on the line, obviously, if it's a super popular place, you could be in line for 15 minutes, but it's that sustained within 6 feet for 15 minutes that the app is picking up on, because again, that's what the CDC and what our Division of Public Health uses as the definition of a close exposure. So enough time, if you're not wearing a face covering, that it's likely you've been exposed to enough of the virus that you could potentially come down with SARS-CoV-2, COVID-19 yourself.
Okay. So if I'm at like a gathering at a friend's house in their backyard and I'm sitting next to somebody that I'm meeting for the first time for more than 15 minutes, that's more likely of a scenario where the phone's going to be exchanging data. And then if one of us tests positive later, the other person will get a ping because we were sitting next to each other, having a lemonade and getting to know each other for more than 15 minutes.
Yeah. And we think that that's exactly the type of situation where right now, despite our best efforts and our robust contact tracing system that's been stood up in the last few months, if somebody can't tell us who that person is, or if they're like, I don't remember, I think their name was this,
right.
But we don't have a phone number, it's just impossible to contact them. And so we're very likely missing exposures, and we're missing the opportunity to let people know. And what we've heard from people is that, they do want to know. People don't want to be out and about. If they've been exposed, they want to know so that they can be extra cautious, and that they're not potentially putting, roommates, family members, their coworkers, like people don't want to put other people at risk. But we do think it's important, though, to put this in context of the larger response. None of these tools or techniques alone are enough to halt the spread of COVID. So again, this is a tool, but it's not gonna, we don't want people to then say, well, I have the app, so I don't need to wear the face covering, or I don't need to worry about the distance, or I don't need to be tested. All of those other public health tools, hand washing, the hand hygiene, not touching your face.
Right. Hands away from the face at all times.
Hands away from the face. There was a great meme at the beginning that was like, little did I know before the pandemic that my activities were face touching, going to non-essential businesses, and like eating at rush. It's just so funny how much of our lives completely, you're like, oh no, don't do that anymore.
Exactly. I think this is a great moment to pause and look at the video that the state created to sort of walk everybody through the app, and we'll continue the conversation. But I think we can go ahead and play the video now.
Great. Thank you.
When you open the COVID Alert DE app for the first time, you will be prompted to select your age. If you are under the age of 18, the application will thank you for your interest and inform you that you do not meet the age requirement to use the app. If you are over the age of 18, the application will take you to the onboarding screen. Here you will review the 3 key features of the application: exposure alert system, symptom check-in, and updates. Privacy is paramount to the COVID Alert DE application. On the next screen, you will review the data privacy policy and have the option to submit anonymous app usage statistics. You can review the data and privacy policy anytime online. Next, you will be prompted by COVID Alert DE to enable the Exposure Notification System, or ENS, on your device. During your first COVID check-in, the application will ask you a series of optional demographic questions. Any information you choose to enter will remain anonymous at all times. Once every 24 hours, you have the option to perform a daily COVID check-in. This anonymous information can help you keep a record of symptoms or changes in your health that you may be experiencing. If during the COVID check-in you record any symptoms that may be related to COVID-19, you will be presented with recommendations and links to additional information about COVID-19 from the Delaware Division of Public Health. COVID Alert DE also provides updates on the fight against COVID-19. If the exposure notification system detects that you may have been in close contact with someone who has tested positive for COVID-19, your device will generate an alert and prompt you to open the COVID Alert DE application for further information. If you have tested positive for COVID-19, a member of the Delaware Contact Tracing System team will reach out to you. During the interview process, they will inquire if you have the COVID Alert DE app installed and if you would be willing to upload a 6-digit code that allows your phone to share special anonymous keys, which are random numbers that change every 10 to 20 minutes running in the background. Once you upload the code, the app can now work with the ENS on your device to upload the anonymous keys. The app does its work in the background, checking your phone's keys against keys from other phones it has been near since the date they were tested. If there's a match, COVID Alert DE alerts the individual. Download COVID Alert DE free in the App Store or Google Play Store.
Amazing. So it looks so user-friendly. So as I'm seeing this, the daily health checks that you can do, are you recommending that folks do log into the app every morning while they're having their coffee, or maybe every night while they're brushing their teeth, to fill out the health screenings?
Yes, I think it's incredibly important. And I believe this is also a feature in the mobile app that New Zealand was using. I mean, we all know everyone's so busy and we're so overwhelmed just with everything happening in the world right now. And so if you do get called by a contact tracer, it's already an experience where you're having this, I imagine a scenario where you're like, oh my gosh, and you're scared because they're telling you you've been exposed and they're getting all this data. And then they say, well, have you had symptoms? And you're like, I don't know, have I? And so in that type of scenario, it can be really intimidating and you're nervous. And so remembering if you had a symptom yesterday or 3 days ago, it's really hard. And so this is just a really quick way. I think you're right. We absolutely loved and wanted to go with this app and the vendor because it's very intuitive and easy to use. It's just a very quick way to jot down if you're feeling any symptoms. And so again, even if you're not called by a contact tracer, but all of a sudden you start noticing a pattern with your symptoms and you're saying, oh, wow, maybe I have COVID. When you go to talk to a contact tracer and they're trying to help you walk back and think about who they need to reach out to because you may have exposed others, knowing when your symptoms started is a key point for contact tracers, because what they'll say is, who were you around? Again, that less than 6 feet for 15 minutes or more. Mm-hmm. Who fits that category 48 hours prior to your symptom onset? Or if you didn't really have symptoms, then it's 48 hours prior to your test. So again, it starts to matter whether you started having symptoms on Tuesday or on Thursday or right. Friday versus Monday. And again, the app just enables you to do it in a much lower pressure environment where there aren't 10,000 things running through your mind as someone's telling you either, yes, you have COVID or you think you've been exposed. And I do, from a privacy perspective, want to reassure people that information, all of the information in the app is anonymous, including the symptom tracker. None of that gets transmitted to the state or to anyone. So it's really it's like a diary, and that it's for the person to log and have for themselves. And again, if they're called by a contact tracer, it's up to them to share that information with the state or with their healthcare provider, or whoever they choose. But it's not something that, again, the state is receiving. We see general. Anyone who uses the app will see general metrics on, 98%. This is how many people did a symptom check-in, and 98% are saying they have no symptoms, and 2% are. But again, that what you put in, you personally, it is up to you to decide whether you want to disclose that to somebody, not, again, anything that's automatically shared.
That's great. That was going to be my next question was, if I wake up tomorrow and I check all the boxes for, symptoms, does that automatically trigger, notification to the state or anything like that? But it sounds like it's a little diary on our phone, our little COVID diary.
The thing we never thought we needed, but now we do.
We do. There's so many things in 2020 that we didn't know we needed. And now here we are.
I know.
So accessibility is really important now more than ever. And that's for a language based question here, but also a location based question here. So is the app available in Spanish is my first question in terms of accessibility. It is amazing. Yes. And in terms of location, not everybody who lives in Delaware works in Delaware. Why they don't work in Delaware is beyond me, because it's an amazing state. But if they do travel beyond state lines for their employer, does the app still work in terms of the data sharing that it does?
So we are asking people, and there'll be more announcements next week about other states. We think next week. We were proud to be first out of the gate. But there's been lots of conversations, and we know there's other states that are looking to deploy this exact app. They may have some slight tweaks based on what guidance they give through their public health department, but there will be COVID alert and then the other states. So there is going to be that level of interoperability. We are asking that people download if you're going to be tested in a specific state. So if you live in Delaware and expect to be tested in Delaware, even if you're a college student and maybe you're a graduate student, or you're just hanging out here, but you have a driver's license that says you live in New Jersey or somewhere else, wherever you're spending the bulk of your time and wherever you expect to be tested, we are asking people to use the COVID Alert DE app, because it will be the Delaware Department of Public Health that is getting the information on the test results. And then their instructions, when they contact you, will then mirror the instructions in the app. So again, it will have interoperability with other exposure notification apps in surrounding states. But again, if people expect to get tested in Delaware and are spending the bulk of their time in Delaware, we want people to download the COVID Alert DE app, but then, obviously please use it as you're moving out and about, even if it's beyond Delaware.
Awesome. Yeah, well, definitely. It's a busy time of year, and it seems like a lot of states are rolling out a lot of this technology at the same time. So Delaware's nestled between all these different areas and states and everything. So I'm sure as more information comes out, people will maybe have many apps on their phone for depending on where they live and work and everything. Awesome. So how does the app fit into Delaware's overall response to COVID-19? I know I've seen, Governor Carney do so many press conferences, and there's been so much information coming out for over 6 months now since all this began. But how do you think this fits into sort of the overall strategy of the state of Delaware combating COVID-19?
Sure. So again, with traditional contact tracing, you really do need to know the people. And so we just kept hearing consistently when we were calling folks, they would say, I was at my friend's house, but I thought they knew who this person was, but they must have been a friend of a friend. I'm sorry, I don't know who they are. Or, we heard that down. We had obviously a mini outbreak in the beach communities in June, driven by younger folks. It was a longer time ago than I wish to admit that I would have probably have been part of that group down there, just down there for the summer, working, hanging out with people who work in the different bars and restaurants, like group houses. And so again, we found kind of in scenario after scenario that people were saying like, oh, I know there was someone else. I don't know her phone number, or I don't know his phone number. I don't know their phone number. So again, we just really were interested in something that would enable us to fill that gap. Like, how do we actually start to let people know that they have been exposed so that they can stop the spread and protect their loved ones and family members. And why we really, again, I'm so excited to be here today with you is that really, which is scary, the 18 to 34 group has the highest number of COVID positive cases in Delaware out of any age group. They're more than a third of the 19,000 cases that we've had since March, which is more than 6,200 people. Unfortunately, also in that 18 to 34 group, we have seen some people succumb to COVID, with 12 out of our 619 deaths coming from this demographic. So, we really, again, wanted to give people an intuitive tool that not only helped them protect others, but really helped them protect themselves and understand that, again, they had potentially been in touch with or in close contact with somebody who had COVID, so that if they started having symptoms, it would be much more top of mind for them that it is COVID and that they needed to act quickly to get care, talk to a healthcare provider, isolate, take good care of themselves. Yeah. Because again, everybody's busy. Sometimes the sniffle, in a pre-COVID world, the sniffle was just the sniffle and you kind of moved on with your life. But we know, again, it can be for certain age groups, especially millennials and younger, a sniffle literally could be the extent of their COVID experience, which is great for them. Obviously, we don't want anyone to get sick or be severely sick, but who they come in contact with then matters, because if they go visit a grandparent or a sick relative or a friend that has multiple chronic conditions, that person may not be so lucky. So again, we just really are excited about this to really just enhance our general response and really, again, give, we want everyone to use this, but, with mobile technology and cell phones, we thought this would be very appealing, again, to the demographic where we're seeing the largest number of cases right now.
Amazing. So there's so much information, and I just want to review it for all the listeners and for myself. So you download the app, and you have these daily health checks that you can do. I go about my life. I have the app on my phone, pretty much going about normal. I'll probably fill out the health screenings in the morning while I'm sipping my coffee. And then say I start to feel some symptoms of sniffles or body aches, maybe some loss of taste or something like that. I decide to get tested and I do get a positive test result. Then I get a code and I'm able to input that into the app by my choice, right?
Mm-hmm.
And
Yep.
that will trigger other people knowing if they've been in close contact with me for more than 15 minutes that they have potentially been exposed to the novel coronavirus.
Yep, exactly. Yep. So, and again, at every step, this is really about, it's up to people to make the choices. Again, we really hope that people download the app and have it on, have their Bluetooth enabled, have the app on their phones. Obviously, that's an excellent first step, and it's available right now. We've had almost 19,000 people download it since we launched Tuesday, which is awesome. But want people right now to go to the App Store, go to the Google Play Store, download it. Make sure their Bluetooth is enabled, have it on in the background. And then if people get called by a contact tracer, we want people to pick up the phone and actually have the conversation with the contact tracer, where, again, like you said, they'll get asked, do you have this app? And great, here's a code. Again, at that point, it's up to the user to decide whether they want to input the code or not. Obviously, we really, really very much want people to input the code. But again, it is still a choice that someone has the opportunity to make for themselves, whether they want to enable, again, the notifications for other people. I will also say that, this is a wonderful tool. There's no perfect tool. This app isn't going to know whether you are wearing a face covering. We got asked the question like, well, I work in a cubicle And if you measure the distance between my cube, the person on the other side, like I'm worried it's not 6 feet, but we're all wearing face coverings. We're all very careful. We're doing the hand hygiene. Am I still going to get an alert? And, again, for this technology, it depends on the barrier that's in between. For anyone that's used a Bluetooth speaker, sometimes like depending on where you are in your room, or if you leave the room with your phone, the speakers will stop playing. So it's, again, a similar technology. But there is a chance. And so for people like medical providers, doctors that are seeing COVID patients, or, people who work with folks that are likely to be COVID positive, we ask them to think about, again, do they leave their phone in their locker? Because if they're on a job site as a medical professional, they're wearing their full personal protective equipment. The person has a mask. It could still trigger the alert, but that you took the precautions to be safe. So it's not going to be perfect, but we think, again, it's a huge leap forward in people having a better understanding of, again, what their exposure risk is.
And obviously to slow the spread of the coronavirus, because
Absolutely.
if you get the alert and you've been exposed, you can choose to self-quarantine for 14 days, 10 days, whatever you think, whatever the guidelines are, somewhere in that time frame, and hopefully prevent spreading it. So we're sort of wrapping up here, and I'm just sort of left with this feeling that it's getting into election season. We obviously had the Delaware primary this past week. Hopefully everybody sent in their absentee ballot or safely went out to the polls. But this seems like another thing that citizens of the state of Delaware and those who interact with Delaware on a regular basis can do to really help their community members here, right? This is the season where we start talking about what you can give back to your community and what your civic duty is, and that expands way more than just voting, right? And so wearing the face mask, of course, maintaining 6 feet of social distance, limiting our in-person gathering exposure, no touching the face, washing the hands, all that good stuff. But downloading the app seems like something that we should be adding to our toolbox of how we can all work together to keep everyone healthy, slow the spread of the pandemic, and really serve our own communities.
Could not have said it better. Because I love it. That's exactly the message we want people to take away. And again, we, did everything we could to find a tool that, again, is intuitive. It's easy to use. It's not, overly cluttered with a bunch of stuff that, just confuses people. And again, we can assure people that their privacy was paramount. So at every step, it requires people to make decisions about what they do and don't want to share, and it's anonymous and doesn't use location data. You can delete the app at any time you want. Again, the app is hosted in the Google store, so we really did try to, again, go out of our way to be able to offer a tool that also gave people some confidence that their privacy would be protected. And, again, it was still within their control what they did and didn't enter into the app. But totally agree with you. Want people to use it. It's available right now. Use the diary, use the exposure notifications, know your risk, and slow the spread.
That's amazing. Thank you so much for coming on, Molly. There are a few questions that I just want to address before we wrap it. Sure. This app is not necessary for individuals under the age of 18, correct?
That's correct. We looked into it, and there were some obviously privacy concerns, and also from the contact tracing perspective, it requires minors. We have to talk to the parent first. So we're looking at it potentially for future versions, but as of right now, it is only available for 18 and older. It's the honor system. So it's a private app. We don't have any way of knowing whether minors are using it. There's no app police. But again, given the way the rest of our systems work, it's intended for people 18 and older to use.
Awesome. Great question, especially for those of you who have kids who may be going into schools at some point. And the last question is about putting in test results to the app. So we covered that if you test positive, you get that special anonymous code and you put it into the app. But if your test results come back negative, is there any action you need to take with the app?
No, so that's a great question. And we have been asked by people who said, well, why can't I just enter my test result myself? And again, we wanted to have that layer of protection because people can imagine that if somebody had some nefarious intent, they could go stand next to somebody and be like, I'm positive, and then potentially create chaos. So we wanted to make sure that, yes, you have your test result, which is great because you get instructions with your test result about what to do. And so we want you to then, as soon as you get the phone call from the contact tracers, talk to them. And then they will, again, verify your test result and they will give you the code. And again, that's a layer of protection to just make sure that the anonymous code and the keys are only being given to people who we know have a valid positive test for COVID-19 that, again, public health has verified.
Awesome. So much information. And I bet you didn't expect to have to do all this at the beginning of this year.
Oh my gosh. Well, credit is due. I just actually took over as secretary in August. Our previous secretary, Dr. Kara Odom Walker, and then the Department of Technology and Innovation for the state, Secretary James Collins, he has since left state government. So these two intrepid and innovative public servants got all of this moving, and just so pleased to take it over the finish line. And obviously we have tremendous, Ben Hamilton has been in the background of this Facebook Live, making sure I didn't mess anything up. But we just have tremendous people at the Department of Health and Social Services, as well as DTI, who really just, again, saw the value and the vision for something like this, and just got it to this point. So we're so excited to be here, and so excited for you all to hopefully take up the cause with us and spread the word about this wonderful innovation.
Awesome. All the work that you did, and now it is our turn to do the work and go to the App Store and make a download and take our morning coffee with a little health check every single morning. Molly, thank you so much for your time this Friday afternoon. If you're watching this later, please make sure you take that action and download the app. Thank you all for tuning in, and have a wonderful weekend. Thanks, everyone.
Thank you, Val. Thank you, everyone. Have a good weekend.